You're next. Go ahead.
Thank you. Thank you very much, Mr. Chairman. Madam Secretary, first of all, welcome. I heard your opening statement, and I was delighted when President Obama selected you, and I think you are doing and will continue to do a great job. So welcome. I want to call two things to your attention, which are two health priorities of mine. Firstly, I was pleased to see that my legislation, the Early Treatment for HIV Act, which I introduced with Speaker Pelosi, was included in the House Tri-Health Reform draft. We call the bill ETHA. And ETHA, in conjunction with the House's proposal to cover all low-income people under the Medicaid program to up to 133% of the federal poverty level, is a significant step towards reducing the number of uninsured people with HIV in our country. As you know, ETHA, this bill, addresses a cruel irony in the current Medicaid system. Under current Medicaid rules, people must become disabled by AIDS before they can receive access to Medicaid. And this is care that could have prevented them from becoming so ill in the first place. In other words, Medicaid won't help you unless you have full-blown AIDS. And as you know, if someone tests positive to HIV, it could be a number of years before they have full-blown AIDS. So it makes much more sense to help those people once they test positive to try to stave off the full-blown AIDS. And it's an irony that you couldn't do it. So what ETHA does, it gives states the option to provide people living with HIV access to Medicaid before they become disabled by AIDS. President Obama repeatedly in his quest for president said that he supports it. When he was in the Senate, he co-sponsored the bill. And I just want to ask you if I can continue to count on the administration to continue to support ETHA, and will you work with the states to take up this option if it's included in the final reform package?
Yes.
Thank you. That's the answer I was looking for. And secondly, the second priority is home infusion. And we know that some delivery system changes need to be part of our health reform package. And this legislation, the second piece, addresses an anomaly in the Medicare program that forces patients into hospitals and nursing homes to receive their multi-week infusion therapy when the same care could be delivered safely in the patient's home, where the patient prefers to be, with outstanding results, lower costs, and virtually no risk of healthcare acquired infections. So I believe that it makes no sense that Medicare pays for all costs associated with infusion therapy when it is provided in far more costly hospital and nursing home settings, but will not pay for the cost of home infusion. For decades, private health insurance has covered home infusion therapy. It's used extensively by Medicare Advantage plans. Medicaid programs cover it, but Medicare fee-for-service stands alone in the failure to cover the services, equipment, and supplies needed for home infusion therapy. So my bill, which is the Medicare Home Infusion Therapy Coverage Act, I've introduced with 92 members of Congress. I've introduced it with my Republican colleague Tim Murphy, and 20 members of the Energy and Commerce Committee are sponsors. So I'm going to ask you the same question. Can I have your commitment that your staff will work with me and Chairman Waxman's staff on meaningful legislation to close the Medicare home infusion benefit gap?
We will certainly look forward to working with you and seeing what can be done about this area.
All right, I thank you, and I'm turning back my time, minute and 17 seconds. I want it duly noted, Mr. Chairman, to give someone else a chance.
It is duly